This video is kindly sponsored by Thrive Market. Hey guys, it's Maggie and I'm back today to talk all about proctocolectomy surgery, the removal of the rectum, and possibly the colon. I've gotten an influx of messages and comments and questions about this surgery from either people that might be facing it pretty soon or people that are just curious, because when you remove such a vital organ, such an interesting organ that, plays a pretty big part in our everyday to-day life, people have questions. They want to know, how the heck does that work? I had this surgery done due to Crohn's disease back in December of 2019, so I'm about 5 years out from it now, and I want to answer the questions that people are most curious about. Things like, can you have children after this surgery? Or what does the pain feel like? What does the incision look like? These are all things that I have been asked multiple times, so we are going to get into it in this video. All right, so let's talk about why people even get this surgery, because it is a lifelong commitment. This is not an easy surgery. It's permanent and irreversible. So it's a really big decision for people to make. And there has to be a pretty good reason behind why you would get it. You're not just jumping into this for the heck of it. So there's a number of reasons. Things like colorectal cancer can be a cause of this surgery. You might have radiation damage down below, maybe some trauma going on. There's really a number of different things, different like GI illnesses that can cause you to go down this path. For myself, it was Crohn's disease. That's an autoimmune illness of the GI tract, and it really caused a lot of inflammation and irreversible scar tissue to my rectum. Really hardcore in my rectum and quite a bit in my colon. So when I was 16, I wound up getting emergency ostomy surgery. That was to divert my small intestine away from my colon and rectum, so that way they were out of use. The hope was that they would heal. They never did. And so it took me a decade to finally decide, okay, I'm doing well with the ostomy bag, and I feel like this rectum and colon being in place is really causing me a lot of problems. All right, so let's talk about preparing for the surgery. How do you prepare? I've had a number of surgeries throughout my lifetime due to my Crohn's and due to other reasons, some related, some not. And every surgery is a big deal, but this felt like the biggest deal. It's so permanent. You're going to live with an ostomy or some sort of diversion for the rest of your life permanently. It's a huge physical change, but it's also that mental change of knowing you're gonna be different. The physical recovery is tough. You have an incision in a very vulnerable spot because the anus is usually closed during this surgery. Some people keep a rectal stump, but a lot of people, and in my case, lose their anus. So they close it shut, and that you don't know how much you move that area until you've been operated on there. So I did a lot to physically prepare ahead of time. I bought a waffle cushion, which was really great to be able to shift my weight because you can't really sit after surgery. I put a step ladder by our bed so that way I could get up into bed without separating my legs too much. And even at home, like where I knew I was going to recover on the couch, I set up all my stuff, my phone charger, books that I wanted to read, a remote. I even spent a lot of time just prepping what we needed in the house for both my husband and I, grocery wise, like what foods am I gonna eat afterwards? Which is why I really wish I had something like Thrive Market back then, because man, I think that would have made such a huge difference. Thrive Market has really become our go-to to stock up on our grocery must-haves and things like snacks. And we've been using it for over a year at this point, I believe. I think it's actually well over a year. I can't tell you how many times we head to the grocery store with a whole list in mind, get home ready to cook, and realize we've forgotten something just because I feel rushed going to the grocery store. And Thrive Market is a really good way to slow down, shop for the stuff that I want with the ingredients that I want, all without leaving the house. And right now I am pregnant. I'm so fortunate, but I've been trying to figure out ways to make sure that I'm eating enough, and also not just that, getting enough of the nutrients I need, and Thrive Market has made it super simple to look for ingredients I want and dietary preferences that I want. I got a huge variety of snacks in my last order, and it makes me feel a little bit better because I feel like I'm not just eating junk, I'm actually eating healthier snacks. And this can be so helpful for somebody preparing for surgery or recovering from surgery who might not be able to leave the house but is still looking for nutritious foods. You can rely on Thrive Market for your organic grocery needs, filtering by over 90 different dietary preferences and values, looking for things like low sugar, high protein. That's exactly what I did for my pregnancy snacks. Not to mention the convenience of having it all delivered right to your door, and orders over $49 ship free. Thrive also has the highest quality standards in the industry, allowing you to shop their 100% non-GMO products with over 1,000 different restricted ingredients. A really neat feature in their app is the ability to scan a barcode of an item that you really like, but maybe want to find a comparable item that is non-toxic and certified organic, and it'll pop up a variety of options for you. There is no better time to try out Thrive Market. With their New Year's sale, they're offering 30% off top products. Plus, if you use my link thrivemarket.com/LetsTalkIBD, you'll get 30% off your first order, plus a free gift worth up to $60. Kickstart your new year and stock up now. Thank you so much to Thrive Market for sponsoring this video. Okay, let's get back into some of these top questions when it comes to proctocolectomy surgery. For those that might be unfamiliar with this surgery, I think the number one question I get is, how the heck do you work afterwards? If you're removing the rectum, you're having an anal closure, how the heck do you go to the bathroom? That is a very valid question, and obviously, you know, totally okay to be curious about, because you have to go to the bathroom somehow. So like I mentioned earlier, I have an ostomy bag, and what that means is essentially they're taking a piece of intestine, they're separating it from the lower intestines, and they're bringing it through your abdominal wall. This is done in another surgery, usually done prior to proctocolectomy surgery. They don't usually do this all in one go. That would be a lot to go through. So they do this surgery where they take a piece of the intestine, they make a small opening in the abdominal wall, and they sew that intestine into place. And that little piece of intestine that sticks out about an inch or so, it's different for everybody, that is called the stoma. From there, people will wear an adhesive ostomy bag over that stoma, and essentially stool will collect in that bag, and they empty it and change the bag every so often. There are a few different things that they can do. People don't necessarily have to have an ostomy. It's just the most common route to go. There are internal continent pouches. One is called BCIR. There's a number of different methods that they use, different surgical techniques to essentially take pieces of the intestine, cut them apart, sew them back together into an internal pouch that somebody may be able to catheterize. A small opening is left in the abdominal wall. They can put a catheter through to help empty that internal pouch, and then wear, you know, some sort of bandage over that hole rather than having to wear an ostomy bag that fills. There can be some complications with that. It's something that I had looked into previously. I went to a BCIR seminar, but I decided, because of the complications and because of how well I have done living with an ostomy, I'm just gonna stay with the ostomy. I haven't had complications with it. I don't wanna mess with success. So yes, that is how the body works. You have to have some sort of diversion for how to get stool out, and that's usually the way they go, is usually ostomy surgery. Now, what does the hospital stay look like? What is that period after surgery while you're still inpatient? How does that work? What does it look like? How long is it? For myself, I think a lot of people are shocked to hear this. I was only in the hospital for 3 days. For such a major surgery, people are like, what? I went in fairly healthy. Obviously, I had a lot of issues with my rectum and my colon. I had a lot of rectal pain that I dealt with daily, but overall, I would say Crohn's wise, I was okay. I was able to get enough nutritionally through my small intestine, you know, had no issues with my usable upper GI tract. So I would say I went in fairly healthy compared to a lot of people that go in for this surgery. And I sort of felt like I would recover better at home. Obviously, it wasn't up to me. It was up to how my body responded to surgery and how I did afterwards, but it was 3 days, and they did tell me that ahead of time. That first night was definitely the most difficult. Just, you know, right after I had the surgery and started to wake up, you're put on your side, either, you know, left or right side, to stay off of the incision. You cannot sit, you cannot put pressure on your bottom because it's a very vulnerable area that if you spread the cheeks at all, you have the potential of ripping that incision. That was the most difficult. I was so afraid to move at all. But I knew in my head, and this is something that mentally I prepared for, I knew that every day that I got through, it would be better, that that feeling would be temporary, that all the tubes attached to me would be temporary. I had a urinary catheter in because obviously I was not getting up out of bed yet. I had an IV for different medications. I also had what's called a JP drain. It was a bulb drain that went in through to my spine because they learned that I had a fistula and some stuff was going on near my spine. So they did have a JP drain in there just to help collect fluid off of it. And I also had some incisions on my belly, so I'll talk about that in a little bit. But that's kind of everything that I had going on, and I knew, you know, each day that I was in the hospital, another thing would get removed. So the first day post-op, I had the catheter removed. I started to get up and walk. Walking is your best friend. It's hard, it's difficult, you're gonna need help, but it really expedites the healing process and gets you feeling back to normal. I think I started on oral medications. I was pretty nauseated that first day just because anesthesia tends to make you nauseated, but everything that goes on also makes you feel sick. So I threw up. I threw up my first round of oral medication, but after that, you know, things improved. I was able to start eating, and eventually I was discharged home. The car ride home was difficult because we had an hour ride. I made sure that the waffle cushion did come with me to the hospital, and we laid the seat all the way back, and I laid on my side. Let's talk about complications. Any surgery can have a number of complications, but the things that I think come up the most with this particular surgery is the incision not healing well. That's the one, you know, in talking with friends, a lot of people had issues with that. That's also something I mentally prepared for, was the potential that the bottom incision would not heal well. I had the surgery laparoscopically, so the incisions on my belly were, you know, really tiny, less than an inch long. I had maybe 4 to 5, and they all healed perfectly fine. The bottom incision did not heal fine, and this is something that people commonly experience. It's in a dark, enclosed area that often has a lot of pressure and strain placed on it. When you walk, it moves. When you sit, you're putting pressure on it. It can easily split. It can have a lot of difficulty healing. And I think the expectation is that it's going to heal like a normal incision, and it really, most people I've talked to, it takes such a long time, like way longer than they expected. And sometimes it does not heal, and further surgery is required to help close it. There are different surgeries that they can do, like a flap surgery where they take a bit of skin and muscle from different parts of the body to help close it. That is something that I thought about and I asked my surgeon about because I knew it was a potential. Thankfully, I was able to avoid it, but that incision took a year to heal. But gosh, it required so much diligence and just constant dressing changes because the wound tends to be very weepy. It tends to drain a lot of fluid. So I was constantly making sure that I was putting fresh gauze in there and other fresh wound products to help heal the area. It can also stall in healing, so it has to be woken up by a number of techniques that can be painful. Things like silver nitrate, which I did have done. They did put some silver nitrate on there to help essentially burn the skin. It's like damaging the skin to wake it back up to start healing again, because sometimes it gets stuck and it doesn't want to heal anymore. But I'm proud to say it did eventually heal. Now, what does that incision look like? Obviously, my belly ones, like I mentioned, they're so small, they heal well. Laparoscopic incisions wind up being almost invisible most of the time. But the one on your bottom, you know, it's interesting. It can look a little bit different for everybody, especially if you wound up having further surgeries like the flap surgery, that can look a bit different. For myself, my incision wound up splitting a little bit, okay? It sort of opened up and had to heal a little bit from the inside out and sort of fill in. It didn't fill in all the way, but it's sort of strange. It looks like when it sort of split, there was a little skin bridge right in the middle, so that's still there. And then there's two pockets, one like further back and one further up, and it almost looks like if you weren't looking close enough, it almost looks like the hole is still there, okay? But it's not. It's skin. And I know I've had some people say, when I say my anus was closed, how the heck do you close a hole? The best way I can describe it is like a drawstring bag. You pull the cord on the drawstring bag and it closes. Like, imagine that. But overall, looking at my bottom, it does not look different. You really have to get in there to see that there's something missing. What is the pain like? Okay, like earlier I said, the pain is not to be messed with. It is a painful surgery. I don't want to kid anybody about that. It's definitely something that I think the mental prep that I put into that, like, I knew it was gonna hurt, and I knew it was gonna hurt for a while. That helped me so much. I've had other surgeries where I did not think about the pain so much. I just went in and thought, oh, it'll be fine. And it was so much harder because I just didn't expect the amount of pain that I would eventually have. Because I mentally prepared that, yes, this is going to be painful. You're going to have to position weird. You're going to be relying on this waffle cushion for so long. You're not going to be able to sit for long periods of time without leaning to one side or the other. It's going to be a pain in the butt, literally. Depending on, you know, how they keep the incision closed. For myself, they used real stitches. They did not use the dissolvable kind because I had had a history of wounds kind of separating and dehiscing with dissolvable stitches. They used real stitches, and every time I sat, it felt like stinging and pulling until I had those stitches removed. And I will tell you, the day that I had those stitches removed, that was one of the most painful experiences of my life. And I wish that they had knocked me out. If somehow I ever grew that organ back and had to go through this again, I would ask them to please just put me to sleep, to take these out, do something better. I was taking pain medication at the time, and it's just painful. But, you know, I had my support person, my husband, there with me, and they brought in some help from their office because they knew I was in pain, and they helped me get through it. Once those stitches were out, it was such a relief. It felt so much more comfortable. Obviously, it still hurt, but there wasn't this pulling on the skin. From there, I would say I had dull pain for probably 6 months. And as the wound continued to heal, you know, that improved. But it took a while. Nowadays, I do not feel any pain down there, and I'm so grateful. Some people do have some nerve pain. I am not one of them. You know, I can ride a bike, I can sit on a bike seat totally fine. Everything is pretty okay down there. It does not feel like much of anything. I'm not aware of it, which is exactly what I wanted because I was constantly aware of it beforehand. How long was recovery? Well, I kind of mentioned, you know, the pain lasted for 6 months. The actual incision took about a year to fully close, fully heal, where there was no red tissue open. It took about a year. And I would say at that year mark, I felt pretty back to normal. That sounds like a really long time, and I know it does, but I was able to live life. I had quality of life in that year of healing. You know, we got married. I actually had another surgery in that time period on my kidney. We did a lot of stuff, and it wound up being okay. It did take a lot of focus of caring for the incision. That was really the biggest part, and going to the appointments to have them look at the incision, that was a lot. But, you know, gradually over time, it got better. So what is it like long term? I'm 5 years out now, and it feels like pretty much nothing to me. The only time that I'm ever aware something is different is when I have phantom rectum. So this is sort of a strange phenomenon that a lot of people experience. It's a very strange feeling of having to go to the bathroom the old-fashioned way, even though you don't have those organs anymore. And I noticed it a lot more early on, I would say probably daily, and then it sort of started to gradually go away. The only times that I feel it now is when I'm having my period and having period cramps, because down there, you know, everything's kind of close by and connected. It kind of like bugs the nerves in the area and irritates. I don't know. It just, it feels like I have to go to the bathroom. I also have felt it occasionally when I ovulate, and then in pregnancy, I've felt it. So early on, you get like a little bit of cramping. Kind of made the phantom rectum come about as well. But now that I'm further along in the pregnancy, I don't feel it as much. It's sort of strange. I'm sure that will change as we get further along, like towards the end. But right now we're doing okay. Sometimes I will just go sit in the bathroom, let the feeling pass. Other times I will ignore it. I really haven't found anything that just gets rid of it other than time. All right, so finally, let's talk about intimacy. Let's talk about the ability to have children. So they're all kind of related, and that's why I want to talk about that together. I want to talk about pelvic floor changes. They all kind of run together. So one thing I didn't expect with this surgery was the pelvic floor changes. I did not know that the rectum provides a lot of support to the female reproductive system, and I'm talking from a female perspective. I don't know what it's like with the male organs because I don't have them. I have heard from friends that erectile dysfunction can be an issue after this surgery because it is closely related to each other. For myself though, I wasn't aware of how much support the rectum provides to the vaginal wall. So afterwards, I was experiencing not just pain with intimacy, but also a lot of pooling issues, both with my period and with other fluids, like regular discharge that you have throughout the month, where it would kind of collect and then all come out at once. I went to pelvic floor therapy to help with the intimacy issues, help to work out the muscles. I learned that my muscles, my pelvic floor muscles, were overcompensating for the loss of the rectum. And so everything was super tight. My muscles were like in overdrive. So we kind of had to work them out to make the pain go away. But also we learned that there was a little bit of a pouch where fluid could collect in the vaginal wall. And so with the help of the pelvic floor therapist, I learned ways to help get that fluid out. But it's something to just think about, potentially expect after you have the surgery. In terms of having children, so it is a little bit known. There aren't a lot of studies, and I have researched this quite a bit, but there is some knowledge that people have difficulty getting pregnant after this surgery, and they think it's likely due to scar tissue buildup. I have friends that have gone through very similar surgeries and had little to no issues getting pregnant. I have had a number of friends have issues getting pregnant, whether they needed some fertility help or a lot of fertility technology help. And for myself, I was one of the people that had a lot of trouble. We tried for about 4 years, a little under 4 years, and had some complications, did seek fertility help and had some complications with that. And then, randomly in August just got pregnant naturally after 4 years. So it's strange. I think the body is different for everybody and it works a little bit differently for everybody, but that is certainly something to ask your doctor about and, ask if you are interested in having children. Is this a surgery you should wait for? Do you have time to wait for? Is it risky to wait for? I know there is another YouTuber on here, 𝙗𝙪𝙨𝙨𝙨. She has talked about this surgery and how she put it off until she was done having children. So for myself, it was too bothersome. Like I felt like I had too much inflammation and it was too aggravating to my body to keep the organs in there, and I felt like I would have a better chance of pregnancy if I didn't have them. So, it was kind of a risk I took. But thankfully, as of today, I am over 21 weeks pregnant. So we're keeping our fingers crossed that everything goes well, but that can be difficult. People wonder, do you have to have a C-section with pregnancies and these surgeries, with ostomy surgery, with proctocolectomy surgery? That's not necessarily the case. I know people who have had identical surgical histories as me, and they've gone on to have 2 natural births. So it really just depends on the individual. I don't know how it's gonna work out for me. I'll let you know. Ask me in about 20 weeks and I'll update you. Proctocolectomy surgery. It's an intense one, and there's a lot to think about when it comes to it. This video I tried to make quick and just cover really key topics in it that hopefully you can look further into, just to make you aware of potentially things to expect. But I am proud to say that I have lived such a full life, despite not having those organs anymore and living with a permanent ostomy. I live well. You know, I'm married, I'm expecting a baby, I've worked, I used to work as a bedside nurse. Like, I have lived, and I think I've lived because I've had these surgeries. I was not doing well beforehand. So if you're in that position and you're really struggling physically with your health, and you know, you're nervous about this surgery, ask all the questions, look up patient experiences online. They're all gonna be different, but you know, it really helps you to figure out what questions you are really interested in, the topics that are most going to affect you. So anyways, thank you so much for watching this video. Thank you to Thrive Market for sponsoring. Remember, with their New Year's sale, you can get 30% off top products. Plus, if you go to my link, thrivemarket.com/LetsTalkIBD, you can get 30% off your first order, plus a free gift worth up to $60. So thank you again, Thrive, for sponsoring, and I will see you guys in the next. Bye guys. Thank you so much for watching today's video. If you are looking for a way to help support my channel, consider liking this video or even subscribing. You can also check out my store at LetsTalkIBD.shop. I have stickers and hoodies like these guys over here, just related to chronic illness and inflammatory bowel disease, something fun. And I also have a coupon code for my YouTube watchers. You could also become a member of my channel, like the wonderful people scrolling on screen here. They've become a member and they have access to videos a little bit earlier. It's a great way to support my channel, and really, just watching my videos means the world. Thank you so much, and I'll see you in the next.